Hello friends, so this is my workstation where I do all my sonographies, which includes routine obstetric sonography and some specialized scans like nuchal scan, anomaly scan, fetal echo, Doppler study, and also some of the invasive procedures like amniocentesis and chorion villus sampling. So here is my buddy. Discuss about very important screening tests available to find out the chromosomal problems in your unborn baby. Now, what are these chromosomal problems? Well, your baby can be mentally retarded because of thousands of genetic problem or chromosomal abnormality. It is not possible to pick up each and every genetic problem in the baby, but some of the common chromosomal problems like trisomy 21, 18, 13, some other chromosomal problems, we are able to pick up with the help of screening as well as diagnostic tests. So what are screening tests and what are diagnostic tests? Screening tests will just help you find out the possibility of that particular chromosomal problem in your baby, whereas diagnostic test will help us either confirm or rule out that particular problem in the baby. So first we are discussing about the screening test for chromosomal problems in the baby. Which are they? They are the first trimester and the second trimester screening test. First trimester screening tests are done at around 11 to 14 weeks of pregnancy, and this includes a combined test which is a combination of nuchal scan and double marker. Nuchal scan is a sonography which is done on the mother, and double marker is a blood test which is a biochemical test which is done on mother's blood. So what we do in the nuchal scan is we look at certain markers which will tell us about the possibility of chromosomal problem in the baby. Which are these markers? The most important marker of it is nuchal translucency, that means the thickness of fluid behind the neck of the baby. There are other markers also like nasal bone, ductus venosus, tricuspid flow. So if you add all these markers and the biochemical markers, that is blood test on the mother, beta HCG and Pepe, all put together gives us the sensitivity of 90 to 95% to be able to find out the possibility of common trisomies in the baby or the unborn fetus. Now, this is about the first trimester screening test. There are certain second trimester screening tests. Suppose the patient has missed the first trimester screening test, there is one test known as quadruple marker which can be done from 15 to 20 weeks of pregnancy, and this assesses 4 hormones in the mother. It's a maternal blood test, and again this will tell us about the possibility of some common chromosomal problems to the tune of 80% sensitivity. So if the first trimester screening test has been missed, one can be offered the second trimester screening test which is known as quadruple marker. Now again this will tell us about some of the common trisomies like trisomy 21, 18, 13, some sex chromosome abnormalities, and therefore those who fall in the high risk category after either the first or second trimester screening test are offered diagnostic tests which are needle tests, that is chorion villus sampling and amniocentesis. I will discuss about the diagnostic test in my next video, but just to tell you, just to brief you about it, these are the diagnostic tests, needle tests, which will help us confirm or rule out a particular chromosomal problem in the baby. Screening test will not confirm or rule out the chromosomal problem in the baby. It will just give the risk or the possibility of the problem, whether it is high or low, whereas a diagnostic test will tell us whether that particular chromosomal problem is there in the baby or not. And these screening tests are very important because you get a very crucial information about the possibility of chromosomal problems right at 11 to 13 weeks, that is early pregnancy, and therefore the decisions about the rest of the pregnancy can be made based on this particular test which is done at 11 to 14 weeks. Stay tuned for my future videos. Till then, stay safe, stay happy. Thank you.